This call underscores the importance of ensuring access to these essential services for everyone, everywhere. Reproductive rights are human rights, fundamental to individual well-being and societal progress. The UN's message is clear. We must renew our commitment to the principles established at the 1994 International Conference on Population and Development. These principles emphasize the right to make informed choices about reproductive health. This is a matter of human dignity and equality. The world faces a convergence of crises, pandemics, conflicts, climate change, and inequalities. These crises disproportionately impact women and girls. Their access to essential health care is often compromised. The UN's message is a call for unity and action. We must ensure everyone can make informed decisions about their bodies and futures. The ICPD outlined a bold vision, a world where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. This vision was grounded in the understanding that empowering women and girls is crucial not just for their own well-being, but for the progress of entire societies. Health expert, media, post-Cairo conference health advancements. Since Cairo, significant strides have been made. Maternal mortality rates have declined globally. Access to modern contraception has increased. More and more people are able to access information and services related to their sexual and reproductive health. These achievements are a testament to the power of collective action. They demonstrate what can be achieved when governments, organizations, and individuals work together towards a common goal. However, the journey is far from over. Many challenges remain in realizing the full vision of the ICPD. Harmful practices such as child marriage and female genital mutilation continue to violate the rights and well-being of women and girls. Stigma and discrimination surrounding sexual and reproductive health persist, preventing individuals from accessing the care they need. Activist. Funding for sexual and reproductive health programs remains inadequate. This lack of investment undermines the progress made and hinders the ability to reach those most in need. We must prioritize funding for these essential services if we are to achieve our global goals. Emerging challenges, such as climate change and increasing conflict, threaten to exacerbate existing inequalities. These crises disproportionately impact women and girls, further jeopardizing their access to healthcare and education. We must address these interconnected challenges in a holistic and equitable manner. Lockdowns and disruptions to healthcare systems have made it difficult and, in some cases, impossible for individuals to access essential reproductive healthcare services. This has resulted in unintended pregnancies, unsafe abortions, and increased maternal mortality rates. Government official. The pandemic has also diverted resources and attention away from sexual and reproductive health programs. This has further strained already under-resourced systems, jeopardizing the progress made over the past decades. The pandemic underscores the importance of investing in resilient health systems that can withstand shocks and continue to provide essential services, including sexual and reproductive health care, even in times of crisis. Section 5. Women and girls, bearing the brunt of inequality. The challenges to achieving sexual and reproductive health and rights are multifaceted and interconnected. However, one group consistently bears the brunt of these challenges: women and girls.
They are disproportionately affected by lack of access to services, harmful practices, and discrimination. Women and girls often face significant barriers to accessing education and information about their bodies and their rights. This lack of knowledge and agency limits their ability to make informed decisions about their reproductive health.
Gender inequality and harmful social norms further restrict women's and girls' autonomy.
They may face pressure to have children at a young age, or they may be denied the right to refuse unwanted sexual advances. Empowering women and girls is essential to achieving sexual and reproductive health and rights for all. This means ensuring they have access to education, healthcare, and economic opportunities.
It also means challenging harmful social norms and promoting gender equality in all spheres of life. Section 6. Access for all, a cornerstone of equality and development. Ensuring universal access to sexual and reproductive health services is not only a matter of human rights, it is also crucial for achieving gender equality and sustainable development.
When individuals have control over their bodies and reproductive choices, they are better equipped to participate fully in society. Access to reproductive health care allows women to plan their families and pursue education and employment opportunities. This contributes to economic growth and reduces poverty.
It also empowers women to take control of their lives and make choices that benefit themselves, their families, and their communities.
When women and girls are healthy and empowered, they can contribute more fully to their communities and societies. This leads to greater social and economic progress for all. Investing in sexual and reproductive health and rights is not just the right thing to do, it is the smart thing to do. It is an investment in a healthier, more just, and more prosperous future for all.
Section 7. Technology, a bridge to equity and empowerment. In an increasingly interconnected world, technology has the potential to be a powerful tool for advancing sexual and reproductive health and rights. It can help bridge access gaps, particularly in remote and underserved areas, and empower individuals with information and resources.
Mobile health applications can provide discreet access to sexual and reproductive health information and services. This is particularly valuable for young people and those living in communities where stigma and discrimination are prevalent. Telemedicine can connect individuals in remote areas with healthcare providers, enabling them to receive consultations, counseling, and even prescriptions for contraception without having to travel long distances.
Digital platforms can be leveraged to deliver comprehensive sexuality education, reaching young people with accurate and age-appropriate information about their bodies and relationships.
However, it is crucial to ensure that technology is used in an equitable and inclusive manner. We must address issues of digital literacy, affordability, and data privacy to ensure that everyone can benefit from these advancements.
Section 8. The power of collaboration, a multi-sectoral approach. Addressing the complex challenges to sexual and reproductive health and rights requires a collaborative approach that transcends traditional boundaries.
Governments, civil society organizations, healthcare providers, educators, and the private sector all have a role to play. Governments must demonstrate leadership by enacting supportive policies, allocating adequate resources, and ensuring accountability for commitments made.
Civil society organizations play a crucial role in advocating for change, providing services, and holding governments accountable.
Healthcare providers are essential for delivering quality services with compassion and respect, ensuring that individuals feel safe and supported in accessing the care they need.
Educators have a responsibility to provide young people with comprehensive sexuality education that is accurate, age-appropriate, and empowers them to make informed decisions about their bodies and relationships.
The private sector can contribute by developing innovative solutions, expanding access to technology, and creating supportive workplaces that promote the well-being of their employees.
Section 9. Investing in the future. Reaping the rewards. Investing in sexual and reproductive health and rights is an investment in a brighter future for all.
When individuals have control over their bodies and reproductive choices, they are empowered to lead healthier, more productive, and more fulfilling lives.
These investments yield significant returns. They lead to healthier mothers and babies, reduced rates of HIV and other sexually transmitted infections, and greater gender equality.
Furthermore, they contribute to economic growth by enabling women to participate more fully in the workforce and by reducing the burden of disease on healthcare systems.
Investing in sexual and reproductive health and rights is not just a matter of social justice, it is a matter of smart economics. It is an investment that benefits individuals, families, communities, and entire nations. Section 10. A call to action from commitment to concrete steps. The UN's call to action is a reminder that words are not enough.
We must translate our commitments to sexual and reproductive health into concrete actions. This requires increased funding for health programs in low and middle-income countries.
It also requires addressing legal and policy barriers.
We must challenge harmful social norms and promote gender equality.
Section 11. Towards a just and equitable future, upholding rights for all. The pursuit of sexual and reproductive health and rights is ultimately a pursuit of justice and equality.
It is about creating a world where everyone, regardless of gender, race, religion, socioeconomic status, or sexual orientation, has the right to make informed decisions about their bodies and their lives.
It is about ensuring that everyone has the opportunity to reach their full potential and contribute to their communities.
It is about creating a world where all individuals are valued, respected, and empowered.
The journey towards achieving this vision is ongoing and requires sustained effort and commitment from all sectors of society.
However, it is a journey worth taking. It is a journey towards a healthier, more just, and more equitable future for all.